Welcome to my channel. In this video, we are going to learn about right atrium. We are going to see about its introduction, external features, internal features, and its clinical correlation. Right atrium. It is right upper chamber of the heart. It receives venous blood from whole body and pumps it to right ventricle through right atrioventricular orifice or tricuspid orifice. It forms right border, a part of upper border, sternocostal surface and base of the heart. External features. Elongated. The chamber is elongated vertically. It receives superior vena cava at the upper end and inferior vena cava at the lower end. Right auricle. The upper end of the right atrium is prolonged to the left to form right auricle. The auricle covers root of the ascending aorta and partly overlaps infundibulum of the right ventricle. Upper end of the right atrium is prolonged to the left to form right auricle. You can see this auricle is covering root of ascending aorta and it partly overlaps infundibulum of right ventricle. Its margins are notched. Its interior is sponge-like, which prevents free flow of blood. Sulcus terminalis. Sulcus terminalis, it is a shallow vertical groove extending along right border of the right atrium from superior vena cava to inferior vena cava. You can see this shallow vertical groove. It extends along the right border of the right atrium. It extends from superior vena cava to inferior vena cava. Internally, it is produced by a muscular ridge called crista terminalis. The upper end of the sulcus contains sinoatrial node. Sinoatrial node acts as pacemaker of the heart. Atrioventricular groove. Right atrioventricular groove. Right atrioventricular groove separates right atrium from right ventricle. It lodges right coronary artery and small cardiac vein. The chamber is elongated vertically. Right auricle, upper end of the right atrium, is prolonged to the left to form right auricle. Sulcus terminalis is a shallow vertical groove extending from superior vena cava to inferior vena cava along the right border of the atrium. Right atrioventricular groove separates right atrium and right ventricle. Lodges right coronary artery and small cardiac vein. Internal features. It has three parts: smooth posterior part or sinus venerum, rough anterior part or atrium proper, interatrial septum. Smooth posterior part or sinus venerum. It develops from right horn of sinus venosus. Right horn of sinus venosus. It shows openings of superior vena cava, inferior vena cava, coronary sinus and vena cordis minimi. Superior vena cava. Superior vena cava opens at the upper end. Opening of superior vena cava is not guarded by any valve. Inferior vena cava opens at the lower end. The opening of the inferior vena cava is guarded by a valve called Eustachian valve. Eustachian valve is rudimentary. During embryonic life, it guards the inferior vena cava blood to left atrium through foramen ovale. Coronary sinus. Opening of coronary sinus is present between inferior vena cava opening and right atrioventricular orifice. The opening of coronary sinus is guarded by a valve called Thebetian valve, valve of coronary sinus or Thebetian valve. Vena cordis minimi. These are small veins present in walls of all the four chambers. They open into right atrium through small foramina. Intervenous tubercle of lower. Intervenous tubercle of lower is very small projection, scarcely visible. It is present just below superior vena cava opening. It is present on the posterior wall just below superior vena cava opening. During embryonic life, it guards the superior vena cava blood to right ventricle. Rough anterior part or pectinate part. Developmentally, it is derived from primitive atrial chamber. It presents a series of transverse muscular ridges called musculi pectinati. They arise from crista terminalis and runs forwards and downwards towards right atrioventricular orifice, giving the appearance of the teeth of a comb. In the auricle, muscles are interconnected to form a reticular network. Interatrial septum. Developmentally, it is derived from septum primum and septum secundum. It presents fossa ovalis. Fossa ovalis is shallow saucer-shaped depression present in the lower part. It represents the site of embryonic septum primum, limbus fossa ovalis or annulus ovalis. It is prominent margin of fossa ovalis. It is distinct above and at the sides of fossa ovalis, but it is deficient inferiorly. Its anterior edge is continuous with left end of valve of inferior vena cava. It represents the lower free edge of septum secundum. Triangle of Koch. Triangle of Koch is bounded by ostium of coronary sinus, septal leaflet of tricuspid wall, tendon of Todaro. Tendon of Todaro is a subendocardial ridge. Tendon of Todaro, opening of coronary sinus, septal leaflet of tricuspid wall. AV node lies at the apex of the triangle. Remains of foramen ovale are occasionally present. This is a small slit-like valvular opening between the upper part of the fossa and the limbus. It is normally occluded after birth, but may sometimes persist. Clinical correlation. Sponge-like interior of right auricle prevents free flow of blood. Thus, it favors thrombus formation. During auricular fibrillation, this thrombus may dislodge and may cause pulmonary embolism. Let us now revise right atrium. External features. Remember these four things. Elongated. The chamber is elongated vertically. It is used superior vena cava at the upper end and inferior vena cava at the lower end. Right auricle. The upper end of the right atrium is prolonged to the left to form right auricle. It covers root of ascending aorta and partly overlaps infundibulum of the right ventricle. Its margins are notched. Its interior is sponge-like which prevents free flow of blood. Sulcus terminalis. It is a shallow vertical groove extending from superior vena cava to inferior vena cava. It is produced internally by crista terminalis. The upper end of the sulcus terminalis contains SA node. Right atrioventricular groove. Right atrium and right ventricle are separated by right atrioventricular groove. It largest right coronary artery and small cardiac vein. Internal features of right atrium. It is divided into three parts: smooth posterior part or sinus venerum, rough anterior part or pectinate part, interatrial septum. Sinus venerum. It develops from right horn of sinus venosus. It has openings of superior vena cava, inferior vena caval opening, openings of coronary sinus, openings of vena cardis minimi, intervenous tubercle of lower. Superior vena cava opens at the upper end, inferior vena cava opens at the lower end. Its opening is guarded by a valve called Eustachian valve, which is rudimentary. Opening of coronary sinus is guarded by a valve called Thebetian valve. Intervenous tubercle of lower is present in posterior wall of the right atrium, just below superior vena caval opening. Pectinate pot, rough anterior pot or pectinate pot, it develops from primitive atrial chamber. It presents a series of transverse muscular ridges called musculi pectinati which arises from crista terminalis. They run forwards downwards towards the right atrioventricular orifice, giving the appearance of a tooth of a comb. Interatrial septum, it develops from septum primum and septum secundum. It presents fossa ovalis, limbus fossa ovalis, triangle of Koch, remnants of foramen ovale. Fossa ovalis represents embryonic site of septum primum. Limbus fossa ovalis represents lower free edge of septum secundum. It is prominent margin of fossa ovalis. It is deficient inferiorly. Its anterior edge is continuous with the left end of the Eustachian valve. Triangle of Koch is bounded by opening of coronary sinus, tendon of Todaro, a subendocardial ridge, septal leaflet of tricuspid orifice. AV node lies at the apex of the triangle. Remnants of foramen ovale are occasionally present. There are small slit-like valvular openings present between upper part of the fossa ovalis and limbus.